Hi, Assalamualaikum. My name is Nur Najib Izzati binti Ramli. Today I want to talk about the anatomy of the shoulder. The shoulder is one of the largest and most complex joint in the body. The shoulder joint forms where the humerus, which is upper arm bones, fit into the scapula. The shoulder blade is just like a ball and the socket. There are four important bones in the shoulder, which is first is acromion, is a bony projection of the scapula. The second is the clavicle, which is the collarbone meets the acromion in the acromyoclavicular joints. The third one is the coracoid process, is a hook-like bony projection from the scapula. And the last one is the shoulder have several other important structures. The important structures like rotator cuff, the bursa, and the labrum. Rotator cuff is a collection of muscle and tendons that surround the shoulders, it giving support and allowing a wide range of motion. The bursa is a small sac of fluid that cushions and protects the tendons of the rotator cuff. A cuff of cartilage called the labrum form a cup for the ball-like head of the humerus to fit into it. The last shoulder muscles are responsible for most of the shoulder's work. Trapezius is responsible for elevating the shoulder blade and rotating during arm adduction. Delta is responsible for flexion and medial rotation of the arm. It's also responsible for arm adduction, extension, and lateral rotation. Pectoral major is the responsible for arm adduction and medial rotation of the arm. It also involved with air intake and in-breathing. Rhomboid majors help keep the shoulder blade attached to the rib cage and allows you to pull your shoulder blade. The rotator cuff muscles. There are four muscles of your rotator cuff keep on the head of your upper arm bone, the humerus, from popping out the socket and the shoulder blade. First one is the supraspinatus, is responsible for beginning the upward motion of your arms after about 15 degrees. The deltoid and the trapezius muscles do their work. The technical terms for the motion is horizontal adduction. And the second, infraspinatus, mainly help the rotation of your arm away from the center of your body. Is the second most frequently injured shoulder muscle. Teres minors help with the lateral rotation of your arm. Subscapularis help stabilize the shoulder joint and allows it to rotate so the arm can turn toward the main line of your body. Other muscle shoulder is pectoralis minor, protect your shoulder blade and allows you to the lower shoulder.
Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you for watching our group video presentation about the shoulders, and thank you for Dr. Ahmad Zulkarnain Ismail and our friends for watching this video. Okay, I'm going to conduct a presentation about the common injuries at shoulder. Okay, common injuries at shoulder is about whether throwing a ball, paddling a canoe, lifting boxes, or pushing a lawn mower. We rely heavily on our shoulders to do a number of activities. Common injuries of shoulders such as rotator cuff tear, shoulder instability, frozen shoulder, overuse or strain, and arthritis. To keep shoulders healthy and pain-free, it's important to know how to spot and avoid common injuries. Okay. The first one, common injuries at shoulder is shoulder instability. Shoulder instability happen most often in young people and athletes when muscles and ligaments that hold it together are stretched beyond their normal limits, caused by certain motion used in tackling or pitching. For example, this motion put great force on the shoulder. If this happens, the clavicle is pushed out of place and may form a bump at the top of the shoulder, as known as a dislocated shoulder. Treatment depends on the severity of the sprain. Sometimes surgery is needed. Okay, this is a figure about the dislocated shoulder. As you can see, there is bump here at the top of the shoulder. Okay. The next one is rotator cuff tear. Rotator cuff disease may be the result of either a substantial injury to the shoulder or to progressive degeneration or wear and tear of the tendon tissue, repetitive overhead activity, or heavy lifting over a prolonged period of time may irritate or damage the tendon. There are different types of tears, which is partial tear and full thickness tear. Partial tear is about an incomplete tear. It damages the tendon but does not completely sever it. Full thickness tear, also called as a complete tear, it separates all of the tendon from the bone. With a full thickness tear, there is basically a hole in the tendon. Treatment depends on the severity of the injury, such as application of ice, rest, physical therapy, and by using non-steroidal anti-inflammatory drug, or called as NSAID, for relieve the pain. Sometimes it goes to surgery process. Okay, this is the figure about the surgery about the rotator cuff tear. Okay, the next one is about frozen shoulder. Frozen shoulder happen when extreme stiffness in the shoulder. It affects about 2% of Americans, most often between 40 and 60 years of age. Frozen shoulder can affect people with diabetes, thyroid disease, heart disease, or Parkinson's disease. The main symptom is not being able to move their shoulder in any direction without pain. Treatment can be NSAID, cortisone shot, or physical therapy. The next one is overuse strain or strain. A sudden increase in activity can place great stress on the shoulders and lead to a loss of flexibility. This is a common problem in middle age, especially among people who don't exercise regularly. Although painful and inconvenient, overuse problem can often be treated with rest, NSAID, and stretching exercise. The next and the last one is about arthritis. Starting as early as age 50, some people get osteoarthritis, which cause painful movement. This happens as the smooth surface of the cartilage that line the bones of the shoulder joint are worn away, and joints start to wear out. Most common cause of osteoarthritis are overuse. The usual treatment are rest, NSAID, and cortisone shot. That's all from me about the common injuries at the shoulder. Thank you for watching our group presentation video. The presentation will be continued by the others. That's all from me. Thank you.
Assalamualaikum. My name is Muhammad Syarizal Fitri bin Muhammad Fazli. In this video, I will explain about the home blower sign test. This test is for a teres minor test. The test will positive if the patient is unable to perform the external rotation. So in the next video, I will explain about the procedure.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Amirul Luqman Birasdan from RSA 24338. Today I'm going to show you about the special test at the shoulder, which is about the scarf test or cross body adduction test. Okay, the purpose for to do this test is to test for acromyoclavicular or AC joint injury and dysfunction. Okay, for this test equipment, I will use the chair and one patient to do this test. For the first step, put one hand on the upper scapula for support. The second step, the other hand bring the patient arm into 90 degree or forward flexion with their elbow also flexed to 90 degree. The third step, make sure the palm of the hand face the floor. For the last step, horizontally adduct the flexed arm across the patient body. For the scarf test or cross body adduction test, the do and don't is, what you must do is you must gently push the arm like this. Okay, and the don't is don't push too hard like this. Why don't push too hard? Because it will be more serious injury to the part of the shoulder. Okay, as for the conclusion, if this test is positive, it is successfully introduce the symptom of pain localized over the AC joint. Okay, that's all from me. Thank you for watching and listening my video. Hope to see you soon and stay well. Stay home. Thank you. Bye.
Hello and Assalamualaikum to everyone. Okay, my name is Muhammad Amir Shafiq bin Syukur from RSR 24338A. Now, I show you a special test for shoulder injury. Okay, the first test is anterior load shift test. This test, position of the patient can be either sitting or laying supine with the arm abducted and alternately rotated. And performing the test, examiner will alternately rotate the shoulder of the patient in order to elicit a response of apprehension. Okay, this is a positive finding for anterior load and shift test. A positive assessment will show anterior instability of the glenohumeral joint. The second test is anterior apprehension and relocation test. The position of the patient is sitting upright. Next, performing the test, examiner grab the proximal part of the humerus and applies anterior and posterior stress to access the anterior stability of the joint. This is a positive finding, apprehension and relocation test. Eliciting pain and sensation of impending dislocation indicates anterior instability. That's all for me. Thank you for the watching.
Patient is seated with examiner standing behind patient. Have patient relax. Palpate anterior margin of the acromion through the deltoid. While doing this, grasp this patient's arm with the other hand at the elbow or forearm. Patient elbow should be flexed to 90 degrees and bring into extension. Passively internally and externally rotate patient arm to palpate rotator cuff tendon. Presence of visible.
Que no se te apague la situación. Tú sabes que yo no te dejo plantado.
Calmao, que yo voy en camino, amor. Calmao, que yo quiero contigo.
Si tú me llamas, nos vamos pa' tu casa. Nos quedamos en la cama, sin pijama, sin pijama.
Si tú me llamas, nos vamos pa' tu casa. Nos quedamos en la cama sin pijama, sin pijama.
Vuelve a contarle mis secretos a tu almohada. Mientras tanto hagamos videollamada. Me manda fotico mostrando todo todito. Cuando llegue de para estamos en la cama. Baby, hoy no vamos a dormir.
No.
Baby,